Good morning, students. We will wait for a few minutes so that others join.
Morning, Miss.
Okay, good morning. Can we start? Because I don't know whether they will come or not. So, is there any, do you have any doubt in last two topics?
No, Miss.
No, Miss.
So, we'll go to the third topic, soft tissue manipulation. So, soft tissue manipulation, like you would have known this particular topic, this is nothing but massage. So, we use this massage to reduce the person's discomfort or to reduce the problem. Okay, so don't compare this massage with any of the spa or anything, because like we don't use all the technique, or we don't learn all the technique. There are n number of techniques around the world in massage, but we are taking the techniques that has a scientific proven things. So that means they do some research, they find out this particular technique will have certain effect, and we will be learning those techniques alone, or those particular massage technique alone. We don't learn the whole massage, because whole massage sometimes like it is like a 6 months course, or sometimes it is like a 2 years course also. Okay, so we are not going in depth about this particular topic. So soft tissue massage, if you see, it is nothing but a manual pressure applied to the tissues. So manually using our hands or using our legs, we will be applying certain pressure to the soft tissues. So soft tissues are nothing but our skin, muscles, tendons and ligaments and fascia. So these are the soft tissues. So we apply certain pressure over this soft tissues, and we will see what is the effect on that. Okay, so we apply the pressure over this particular tissues in certain way, or using certain techniques. So when we use that particular techniques, you will have certain effects and uses of the particular technique. Okay. So this soft tissue manipulation is called in different terms in various countries, and it is not a very new technique. It is a very old technique which has been used since ages, from very olden days, like even before Christ this particular technique was there, and it was used by many of our ancestors. So in North America, they use this massage as a alternative medicine. So alternative medicine means alternative to allopathic. That means how it is uh, when we are talking about allopathy or English medicine, uh, we also do have some traditional medicines, right? So that traditional medicines are called as alternative medicines. So like that, in North America, they use this massage as a alternative medicine. So that much importance they are giving for massage in North America. So like that, if you see, many of the countries are using or still using the techniques, till using the techniques to reduce the patient's discomfort. So as a scientific definition, if you see, this is scientific mode of treating certain forms of disease by systemic manipulation. So manipulation is nothing but giving pressure by hand, or by any by hand, or by legs. So systematically, when you apply this pressure, this will help you to reduce or treat certain form of disease. That is your massage. Okay. So history, if you take, like it is there from many ages. So this is a very normal reaction. So normal reaction in sense, so if you see, like if a mosquito is biting, so what do, you hit the mosquito, then after that you rub the particular rub the area, isn't it? So why do you rub the area? To reduce the pain. So whenever you have some pain or anything, what you do is unknowingly you will be rubbing that particular area, isn't it? So that is your massage. So massage is there in our conscious, in our thoughts. So even without without knowingly, like without cautiously, we will be doing that rubbing, or we will be doing that pressing things. So this will help us to reduce the pain. Okay. Then this is there, like where this is there since very olden days, like even like before the Olympics also, this has, like this massage was there. And most of the time, this Egyptians, Romans, Japanese and Persians were, and Chinese were using this particular massage therapy. So in olden days, if you see, the Egyptians were the very cultured or very modern people. They had lot of traditional methods of treatment and other things. So from them only this massage has started. So this massage has different terminology in different language, or you can see like when in different countries according to their language. So in Greek it is called as masso. Masso means to touch. In Latin it is called as masa. Masa means to touch. In Arabic it is called as ma, to press softly, and in Sanskrit it is called as mahe. So this is also to press softly. So depends on the country, depends on the language they are using, the terms will be different. So what is the effects and uses of this particular technique? So according to the pressure we are giving, according to the speed we are giving the technique, the effects and uses will change. So whenever you do a do the technique in a very mild pressure, then it will be giving a very soothing effect or relaxation effect. But when you are giving a deep pressure and hard speed, then it will help you to increase the blood flow to that particular area. So massage, the effects and uses depends on your pressure you are applying. So if you're using a very mild pressure, it will just relax your superficial skin. It will not have much effect over the deeper tissue. But when you apply deeply, then you will have a very deep effect, or it will give you a good pressure. Okay. So as a physiotherapist, we will be dividing the effects and uses into three. One is your physiological effect. So physiologically, if you see, whenever you do a massage, this will help you to reduce the edema. So how it is helping you to reduce the edema means, when you apply pressure, there will be increase in the blood flow to that area. When there is increase in the blood flow, automatically the fluids whichever remaining in that area is being washed out, or is being pushed out. Okay, so this will be pushed towards the lymphatic drainage, and the unwanted fluids which is causing edema will be reduced or will be removed that from that particular area. Okay, so that is the first effect. So physiologically, the first effect is to reduce the edema. How it reduces the edema means, it will be like when you apply pressure, when you apply the pressure, uh, that particular area will be getting a lot of blood supply, and because of that the because of that the particular area, the particular fluid will be washed away. Okay, so that will reduce the edema. The second therapeutic effect is, it will help you to reduce pain. So how? Like we know, whenever we have a mosquito bite, we will be rubbing that area. So when you rub the area, what happens? The unwanted H or lactic acid or pain producing substance will be washed out from that area. So when it is washed out, automatically the pain will reduce. Okay, so how there are different ways how the pain is reducing. The first thing is, when you apply over the, like whenever there is a swelling, definitely they will have pain. So once you reduce the swelling, automatically the pain also will be reducing. Okay, then second thing is, whenever there is a muscle spasm, then they will have pain. So when you do the massage, this muscles will get relaxed. So once the muscles are getting relaxed, then the pain will be subsided automatically. Then, like whenever there is increase in the blood flow, this will encourage the waste fluids or waste materials to be washed away. Okay, so like normally when you have pain, what will happen? There will be some kind of blood flow, sorry, there will be some kind of chemicals that is present in that particular area that is causing the pain. So when we remove the chemicals are nothing but H plus and lactic acids and other things. So when we remove this, automatically there will be good blood flow and the pain will be totally subsided. It will be, whenever you are giving massage, it will be activating the sensory nerves. So when it is activating the sensory nerves, then automatically the pain will be subsided. So these are the things that will be causing to reduce the pain. Okay, so maybe it is a problem, mechanical problem like muscle spasm. Maybe it is a physiological problem like swelling. Maybe it has some nervous problem. So all these problems will be reduced whenever you give massage to that particular area. So the next effect is it helps you to increase the metabolism. So first is it helps you to reduce the edema. Second is it helps you to reduce the pain. Third is it helps you to increases the metabolism. So once the waste product or once the waste material is removed, automatically there will be fresh blood flow to that particular area. So when there is a fresh blood flow to the particular area, the metabolism will be increasing. Okay, so once there is a fresh blood flow to the area, automatically the healing will be enhanced. Okay, so the relaxation and the refreshing of the muscles will be there because the light pressure from the massage will help you to reduce the increase the relaxation. That is one point. Another thing is when the muscles are feeling refresh and more blood flow is there, then automatically the muscles will become relaxed. Okay, so then next is it helps you to improve the function of the lymphatic system. So if there is any blockage or any other problem in the lymphatic channels, when you do massage, that particular area will be unwanted fluids, that is the lymphatic fluids will be removed. So once it is removed, then it improves the function of the lymphatic system. Okay, so it helps you to reduce or prevent muscle cramps because muscle cramps will occur when there is any electrolyte imbalance. Electrolyte imbalance means it is nothing but whenever you have reduced potassium or increased calcium or reduced calcium, then you will have this cramps. So when you do massage, there will be good blood flow. So when there is good blood flow, automatically the needed nutrients or vitamins or minerals will be rushed to this particular area. So the cramps and other things will be totally avoided. Okay, then it reduces spasm. So we know how it reduces the spasm. So it improves the circulation. So this also we have known already. So it increases the circulation because when you apply pressure, that particular area will be drained out the fluid. So once it is drained out the fluid, automatically new blood will be flowing to that particular area. So this will help you to improve the circulation. Then it improves the skin tone and function. Once it is increasing the circulation, automatically it will improve the skin tone and function. So that's what will happen whenever you go to a spa or whenever you go to a beauty parlor. Whenever you go to a beauty parlor, once she does the massage or anything in the face, you look very bright. You feel as if your color has increased, your tone has increased. So this is nothing but when you do massage, there will be increase in the circulation. So the tone and the color will be enhanced. Okay, and the effect will be there for few days or few weeks. Okay, so then again after the effect goes, again you will go to the beauty parlor. So this what will happen. So like this will increase the skin tone. So from now on, so all the girls, you can do your massage, facial massage at home itself after this particular topic. So these are the physiological effects. Next is psychological effect. So once you feel like, you can see like when you do massage, you will get some relaxation. That is, your muscle spasm will reduce. So once the muscle spasm and the pain reduce, automatically you will feel the you have reduced the fatigue. Okay, so this will help you to help you to reduce the tiredness. Then automatically mentally you will be stressed, you will be relieved from your stress. Okay, your nervous system will be getting calmed down and you will be having a complete relaxation in your mind. So not only your body will get the relaxation when you do massage, your mind also will get relaxation. Okay, so this is a purely psychological effect. That's why when you are coming out of the spa, you feel very happy, because like you have a psychological content or psychological completeness, or you feel as if you something has happened to you. Okay, so these are the psychological effects of massage. So it reduces fatigue. How it reduces fatigue? When it reduces the pain, and when it is increasing the blood circulation, automatically the fatigueness will reduce. So when it is doing this, automatically your mind tension will be relaxed. So your stress in the mind will be relaxed. So your nervous system will get calmed down, and you will feel complete relaxation of your whole body. Okay, so these are the psychological effects of massage. The next is mechanical effect. So mechanically, what happens? So mechanical means like um physical effects. So mechanically what happens means, whenever you do a massage, whenever you apply a pressure, you are going to stretch the muscle. Not only the muscle, you are going to stretch the fascia, tendon, ligament, and other thing. So this will help you to reduce the adhesion formation, or in other words you can say it will help you to reduce the adhesion in the muscles. So this adhesion will automatically will be relieved, so the muscle will be elongated, or the muscle fiber will be elongated. Okay, so this is the first thing. Second thing is, whenever you do a massage, there is a mild increase in the skin temperature. So this mild increase in the skin temperature will definitely increase the sweating, and this mild increase in the skin temperature will give you a very soothing effect that is needed in the muscle, in the skin. Okay, so second mechanical advantages is the skin temperature will be little bit increased. Okay, so this two things will help you to reduce the hardness of the skin, or it will help you to induce the softness in the skin. Okay, so if you see you have a mosquito bite, and there will be a mild spasm or protective spasm around that area. So if you keep on giving pressure over that, automatically the roughness in the skin, or the protective spasm will get reduced. So this will help you to soften the skin. Then it will help you to directly remove the dead tissues. Okay, so directly all the dead tissues will be removed. So this will help you to uh, remove the unwanted products from the skin. Then it helps you to stretch and reduce the breakdowns in the fibrous tissue inside. So these are the mechanical effect that will be there in the massage, or whenever you do massage, you will have all these effects. Okay, so we have seen about the physical property, physiological property, then we have seen the psychological property, then we have seen the mechanical property. Okay, so I stop here for a few more minutes of rest. Don't go out, don't log out, just remain. Okay, so students, can we start?
Yes, miss.
Yes, miss.
So we have so far seen what is the definition of massage. Then we have seen what is the effects and uses of massage. Now we will see what are the indications and contraindications of this particular technique. So first is like indication. There are many indications because this massage has a very vast effects and uses. So the indication also will be more. Okay, so first thing is we see only the indication that is related to physiotherapy. Okay, so we are learning massage from a physiotherapist point of view. Okay, so you keep this in mind. So the first indication is to reduce pain. So we know that this massage will enhance the blood flow. This will remove the unwanted waste products. This will reduce the swelling and this will reduce the muscle spasm. So all these things will definitely lead to reduce pain. So first, when a patient is coming to you with pain, you need to see what is the reason behind that. So for example, a person is coming, has had a fall and he has scratches in his knee and he is coming to you with pain. So at that time you can't give massage. If you give massage, there will be increase in the blood flow, and that increase in the blood flow will increase the oozing. Okay, blood oozing, and there will be lot of blood leakage. Okay, so you need to see what is causing the pain. If the pain is because of muscle spasm, if the pain is because of swelling, if the pain is because of unwanted substance that is accumulated there, then definitely you can give massage. That will help you to reduce the pain. Okay, so the next is tension, stress and tension. So massage has a psychological effect. So that's why a lot of people will go to spa and they do a whole body massage. So that will help you to reduce psychologically. That will help you to relax themselves. Psychologically, it will help you to relax the whole mind and body as well. So this will have definitely will have a very good effect. Then insomnia. Insomnia means sleeplessness. That is, the people will not be able to sleep properly. So that is called as insomnia. So for this insomnia, uh, this is again it's a psychological issue. Okay, so when your mind is not free, when you are in tension, so for example the day before your exam you will not get proper sleep, so because your mind is preoccupied and you are having a lot of tension in your mind, so like that. So once the mind is free, automatically the patient will get proper sleep. So psychologically, when you relax the person, automatically the person will go for sleep. The next is edema. So we know how it reduces the edema. So edema will help you to relax. Edema will be is nothing but the unwanted fluid that is getting accumulated. So when you do a massage, this unwanted fluid will be pushed towards the lymphatic drainage, and the lymphatic drainage will be pushed outward. Okay, so this will help you to reduce the edema. Then depression. So depression, again, it is a psychological issue. So once you are able to relax the person, automatically you will be able to bring him out of the depression. Then any skin contracture. So if a person has any skin contracture, so that is nothing but uh, like it is nothing but a protective spasm, or a spasm that is causing that don't want to allow any movement. Okay, so that is called as skin contracture. So if any person has this kind of skin contracture, maybe because of a scar tissue. So maybe if you fall down, you will have a scar, and that particular scar will be there for a very long time. And there are many types of scar. Okay, so this is called your skin contracture. So when you want to avoid this kind of skin contracture or scar tissue, then you can do massage that will help you to reduce the skin contracture. Then mental and physical fatigue, we know what is the reason, how we are going to reduce it. Then muscle soreness and muscle stiffness. So if there is any spasm or muscle soreness, definitely you will be able to give this massage. So that will help you to. Muscle soreness is mainly because, like, I hope you would have learned about DOMS and DOMS, that is delayed onset of muscle soreness. So that means suddenly if you are in a sedentary lifestyle, and suddenly if you go out and go for jogging, the next day morning you will not be able to get up. You will feel as if your limbs are very heavy, and the limbs are very heavy, and you will not be able to move the limb. So this is because unwanted materials are present in that particular area, and that is causing the stiffness. So you can reduce that particular muscle sore. You can reduce that. Okay, then next is reduce that by increasing the blood flow. So once you increase the blood flow, you will be able to reduce the once you improve the blood flow, automatically the unwanted chemicals like lactic acid or H plus will be washed out. Okay, so all these things you would have learned in your physiology. That's why I'm just touching that particular topics. I'm not going in depth. So the reason behind this muscle soreness is collection of lactic acid and H plus ions. So once you remove this, or once you wash out this, automatically the muscle soreness will get reduced. Okay. Then next is it will help you to improve the skin tone. So that's what happens in spa, and that's why we go to a beauty parlor for doing a facial massage. Then muscle spasm, it will reduce stiffness and muscle spasm. So then joint stiffness. So some techniques will help you to improve this joint stiffness. Okay, so like your peripheral joint mobilization, this massage is also can be used to reduce the joint stiffness. Is that clear? So these are the indications of massage. So almost like if you see all the problems will be included: pain, stiffness, reduced range of motion, muscle spasm, skin tone, all the problems are included. So you will be able to give massage to all the give massage and reduce all the problems. Next is contraindications. Like whenever you have more indications, there will be more contraindications also to look into. Okay, so I have already told you about this. So contraindications you will be having. You can divide the contraindication into general contraindications and local contraindications, then absolute contraindications and relative contraindications. So general contraindications means generally if it is present in any part of the body, you cannot give. Local contraindications means you will be able to give this. For example, if the problem is there in the left leg, but you have contraindication in the right leg, then you can still continue the technique. So that is about the local contraindications. So locally to that specific area, if it is present, then you will not be able to do. But otherwise, you will be able to do it. Okay. Then absolute contraindications means definitely you should not do it. That is called as absolute contraindication. Relative contraindications means with precautions you can still continue the treatment. Okay, so that is called relative contraindications. Okay. Now, so general contraindications, whenever the patient is having fever, whenever the patient is having renal disease or cardiac disease, then you should not do massage. Why? Because when you are doing massage, it will increase the skin temperature. Already the patient is having fever, and if you do massage, the temperature will increase a bit. Once it is increasing a bit, the body core temperature will be increased. So once the body core temperature is increased, that will lead to other problems like seizures disorder or any other problems will be there. So that's why we have to avoid giving massage. 1 minute. Hello. Yeah. Yes, ma'am. Okay, okay, ma'am. Actually, this is related to the admissions. So I'm not sure whether what is there in the medical report. So uh, admissions and yeah, yeah, doctors like medical report in sense like only if they want to do any X-ray or blood test, then they will not be able to do in AIMS clinic. But all other things they can do it in AIMS clinic. Oh, okay, okay, okay. Yes, ma'am. Okay, okay, thank you. Yeah. Okay, I'm sorry. So whenever you have a high fever, then if you do massage, the body temperature will increase. This will increase the core body temperature. If it is increasing the core body temperature, it will lead to further complicated problems like seizures disorder, fits and other things. So that's why we have to avoid while having a fever. Okay, totally you should avoid. You should not do massage at all. The next is if the person has renal disease. So already whenever there is when we do a massage, there will be increase in the blood flow. Once there is increase in the blood flow, automatically there will be more blood will be going to kidney for infiltration. So the person needs to do the filtering and sorry, the kidney has to do more amount of fluids to remove the unwanted waste products. So if the kidney is already damaged, then automatically you will not be able to do the kidney will just give away. For example, already the kidney is very much damaged and it is just working in a very slow pace. So if you just put lot of pressure over it, then the kidney will totally stop working. Okay, same thing for the heart. So if the heart is already damaged and if there is more blood flow rushing to the heart, then the heart will give away. So that's why we have to avoid doing massage for people who are having these three problems. Okay, so this is a general contraindication. Local contraindication, as I said early, if the contraindication is present on that particular area, then you have to avoid. But if the contraindication is there in any other adjacent area, then you can continue the massage. So first is skin infection. So if you have skin infection, once you do massage over that, the blood flow will increase and the infection will be spreading to other part of the body. So that's why you have to avoid it. So whenever you have open wound, so when there is an open wound, there is chance of bleeding. So if you do massage, there will be more bleeding. So more amount of blood loss will be there. Okay, next is hairy skin. So hairy skin, when you do massage, it is a very relaxed technique. When you do massage over a hair, it will be pulling your hair. So if it is pulling your hair, hairy skin, it will cause pain. Okay, so that's why it will be causing some pulling and pushing. So that's why you have to avoid this hairy skin. Okay, next is if you have any signs of inflammation. So normally in pathology you will be reading about this inflammation. So inflammation is a indication to show us that there is healing taking place. Okay, so whenever there is an inflammation, it needs rest. You should not disturb that particular area. So the signs of inflammation are if the person has any warmth over the particular area. So you can keep your hand and see if there is an increase in the temperature, then don't do. Okay, if there is redness, if there is swelling, all these are signs of inflammation. Okay, so if you have this, then you don't give massage to that particular area, because during inflammation that particular tissue needs rest. So after resting only the tissue will be getting healed. Okay, next is DVT. DVT means deep vein thrombosis. So normally what will happen, the blood has to be keep on running or flowing. If there is any stagnant, or if it is stagnant in particular area, then the blood will be there is chances of blood getting thrombused or getting thickened. Okay, so this thickened blood is called as thrombus. So once you give a push or once you do massage, this thickened clotted blood will just move along the blood vessel, and it will go and block the smaller veins in the brain or heart or in any of the body part in the lung. So if it is blocking, then it may lead to death of a person. So if a person has DVT, you should not give massage to the legs. Okay, so usually DVT will be present in the legs or in the hands. So you need to check for this, and we have special test for it. We need to check for it. Once we have a doubt about DVT, then don't do massage to that area, because if you do massage, you are getting dislodging the blood clot, and the blood clot will be moving around to the moving around, and the blood clot will go and block the blood vessels. If it is blocking the heart, it will lead to heart attack. If it is blocking the brain, it will lead to stroke. If it is blocking the lungs, it will cause pulmonary embolism. So all three will definitely, it's like a death of a person. Okay, then if you have any soft tissue injury, you should not give massage, because the soft tissue needs some rest for healing. Okay, if you have any unhealed fracture, then also you should not do any massage. Then if the skin is very hypersensitive, then you should not do any massage, because the hypersensitive skin will lead to some problem. Okay, 1 minute. Internet. Okay, next is relative contraindication. So relative contraindication means you can do massage, but you need to take a lot of precautions while doing massage. So first is osteoporosis. Osteoporosis means weak bone. So normally the bone has two activities that will be taking place. One is osteoblast activity, another one is osteoclast activity. Osteoblast activity means growing of the bone. Osteoclast activity means absorption of the bone. When a person is young, there will be more of osteoblast activity that will be taking place. So there will be, that's why we grow. So when a children is when a child is born, slowly there will more amount of osteoblast activity. So the child will become taller and taller. After some time, if you see, they will stop at one point. Okay, so maybe after 21 years or 22 years, there will be stoppage of bone growth. So this is because the osteoblast activity and the osteoclast activity will be equal in certain age. So when it is equal, there will be growing as well as absorption. So you will not, there won't be any change in height of the person. Okay, then as they are becoming older and older, maybe after 40 years, 50 years, if you see, they will be having lost lot of osteoclast activity compared to osteoblast activity. That means the bones will be absorbed more when you compare to bone formation. So this will lead to weakness of the bone. Okay, so this is, if you see, this kind of things will be present in old age people. So if you see your grandparents, so the height would have, their height would have been reduced. They would have been become stoop, and their the length or the height of them height will be reduced. This is because of the osteoclast activity. These people will have definitely osteoporosis. Osteoporosis means weakness of the bone. When you apply pressure over the bone, it may get break. So if you see, sometimes when your old parents or grandparents, when they are just getting up from the bed, when they give pressure over the hand, they will have hairline fracture. Okay, this is very very common in olden people, old age people. So this is because of osteoporosis. So when you apply pressure over them, definitely it will lead to fracture or breakage. So you need to take proper precautions while giving massage. That means you need to reduce your pressure while giving massage. Next is aneurysm. Aneurysm is nothing but ballooning of arteries due to weakening of blood vessels. Actually, blood vessel is made up of a thick fibrous elastic material. Okay, so as it is as the person is getting aged, this blood vessels will become weaker at certain point. So you can see, while you are blowing a balloon, if you have a weak point in the balloon, you will feel as if some round dark spot is there, isn't it? So that is called as weak point in a balloon. Same like that will be there in the blood vessel. So when the blood is flowing, this weakened area will just balloon up. That means it will just bulge up. So when you apply pressure, the soft tissues will compress this weakened area, and they may burst out. So if they burst out, the person will have internal bleeding, and they will die of internal bleeding. Okay, so you need to take precautions, especially if you are giving massage to old people. You need to take precaution, and you have to avoid a lot of pressure. Okay, next is hematoma. Hematoma means blood trapped in the cavity of a body. So if you fall down, you get bruises. After 2 or 3 days, if you see, you will see some black spots in that particular area. So those black spots are nothing but hematoma. Okay, so if you have hematoma, then don't do massage, because sometimes it will lead to breakage, and sometimes it will lead to blood leakage. Then same thing, contusion, bruises. So all these things will lead to blood leakage. So you should avoid pressure over when doing massage over this particular areas. Next is lymphedema. Lymphedema is nothing but it is a condition, or it is a disease that is caused by lymphatic problem. So if in our body we have something called lymphatic system. So lymphatic drainage. So the waste fluids will be running in the body, and it will be getting out through the lymphatic drainage. So we have lymphatic drainage in axilla, armpit, in our inguinal region. All these regions have lymphatic drainage. So if there is any blockage or any problem in that particular area, in that particular lymphatic thing, then there will be blockage of the lymphatic drainage. Okay, so you have to see, you massage is the only technique that is indicated for lymphedema, but only thing is you have to take precaution while doing massage. Okay, then for fatigue, massage is the best technique, but you need to take proper precautions while doing fatigue. If the person is having chronic fatigue means more tiredness. Okay, intoxication means any toxic like snake bite or any scorpion bite or anything. So the toxic will be there in that particular area. Don't do massage and spread the toxicity over the other area. Okay, I'm not talking about immediate effect. I'm talking about long-term effect. Okay, so if the person has psychosis is a psychological problem. So if the person has psychosis, then you have to see, because they will not understand what you are doing. They will not be able to respond to you. They will not, if they have find it discomfort, they will not be able to tell you. So don't do when you're doing massage over these people, you have to take a lot of other precautions. So if the person has skin problem, then there is more chance for spreading out of the skin problem. Okay, then you, for that you have to take precaution. Then if the person has hernia, then you have to take precaution. Okay, then if the person is very old, then they might have lot of other problems like osteoporosis, aneurysm. So you need to take proper precautions while doing massage. Then if the person is having high BP, if the person is having high BP, if you make them to lie down supine, automatically lot of blood will be rushing to the brain and it may lead to stroke or some other problem. So you cannot make the person to be lie down in supine lying position. You have to give some pillows and make them erect and sit erect. Okay, so you have to see to that. Okay, so then if they have a pitting edema, so in edema you have two varieties. One is pitting edema and another one is non-pitting edema. Pitting edema means if you have swelling, if you put pressure over the swelling, if it is going down, it is called as pitting edema. If it is not going down, it is called as non-pitting edema. So for pitting edema, when you do massage, it will take long time to subside, because when you apply pressure, the edema will go down. Once you remove the pressure, automatically the edema will come up. So it will take long time. So you need to take proper precaution for that. Next is techniques. So do you want any break before going into the technique?
Can continue.
Okay. So this technique, massage technique, is of 6 types. As I said earlier, uh, there are many types of many massage techniques, and each country follow their own massage technique. But we take up certain techniques that has a scientific evidence, or that has a research oriented evidence. Okay, so based on that, we are classifying massage into 6 categories. So one is touch, second is effleurage, kneading, friction, percussion and vibration. So first technique we will see. So this is a broader classification. After this, again it is classified into sub-classification. Okay, so this is a broader classification of massage. So touch. So touch can be a stationary contact. It can be subdivided into superficial and deep touch. Okay, touch means just the same way how you touch your body, how you touch your how you touch uh, so it is nothing but like you just give a mild pressure and touch the particular person. Okay, so this is your touch technique. So this is a stationary contact of your hand on the patient's body. So normally this contact can be made by fingers, hand or body part. So body part means like can be your forearm, can be your foot, like that. Is that clear? Okay. So this is just a contact. Why you want to have a contact means suddenly if you go and do a massage on a particular person, they will get scared and they will restrict, and they will, instead of getting relaxation, they will feel more of what to say, restricted things. Okay, so you need to that's why you need to just have a contact with the person's body, get accustomed to your person have to get accustomed to your touch, or the person have to get accustomed to your hand. Okay, so you can just imagine when you are just sitting, you just ask the person to remove his dress and go and touch his back. So what will happen, he will get shiver, or he will not feel comfortable, isn't it? So to avoid all those things only, we do this particular technique. Okay, so this technique doesn't have much of effect, but it gives you it makes, or it makes use to your hand. Okay, so you can apply a little pressure or you can apply it superficial. So touch can be divided into two: one is superficial, another one is deep. Okay, so this touch can be just a stationary contact or a moving contact. Okay, so when it is a moving contact, we call it as stroking. Okay, so stroking means just stroke with your fingers. So this is to make the patient accustomed to your body, or to your touch, or to your fingers. Okay, so touch is just a stationary contact between the therapist hand and the patient's body. This can be using your fingers, using your hand, or using any of your body part. So this can be again superficial and deep. The only effect of this touch is it will help you to get used to that particular person. Okay, that is one thing. Another thing is like you can use your fingertips to have a continuous touch, and that is called as stroking. So when you do stroking, you relax the person. You say that this is the contact, this is my finger. You can get used to my finger, so that when you are doing the other techniques, they will get complete relaxation. Okay. Next technique is effleurage. So effleurage means it is the name driven from a French word. So according to that, it is called as to touch lightly. Okay, so according to the French word, it is to touch lightly. So here it is a gentle stroking from one area to the other. Okay, so normally this is done from distal to proximal. So normally this stroking, this effleurage is done from distal to proximal. Okay, so you can use your finger pads, you can use your complete palm to give the effleurage. Is that clear? So here if you see, like, this is the typical effleurage, and usually effleurage is given from distal to proximal. The main use of effleurage is, one is to relax the person, another one is to spread the lubricants all over the body, then to reduce the lymphatic drainage. So the main use of this effleurage is to reduce the lymphatic drainage. So when you do a massage, you will be having any technique, there will be increase in the blood flow. So the blood flow will be pooled in one area. So when you do this effleurage, you are draining out the excessive fluid. So that is called that is the main use of this effleurage. So this is the way you have to hold. Okay, so the whole hand will be touching the patient's body, and you will be giving effleurage from distal to proximal. So while doing effleurage, you will be draining out the excessive fluid into the lymphatic channels. So that's why you have to always drain towards the lymphatic channels. So here you have a lymphatic channel in the neck. You have a lymphatic channel in the axilla. Okay, so always when you're doing a back massage, you have to drain towards the neck or towards the armpit. Is that clear? So this is your effleurage. Okay, so this effleurage, if you see, you can give to a whole. If you are giving to a very big area, then you can use both hands. If you are giving to a very smaller area, then you can use single hand. Okay, so maintain. You have to maintain the contact throughout. Maintain the full contact with the skin. That you have to maintain it completely. Okay, so that is very very important. Then if you do it very superficial, it will be only over your skin depth. When you do it deeply, or if you apply pressure, then it will be helping you to drain out the blood vessels. Okay, so it will reach till your blood vessels. So light effleurage will help you to increase the relaxation, and it will help you to promote the sensory reflex. So when you do it very lightly, it will help you to uh, promote relaxation. When you do deeply, it will help you to drain the lymphatic system, and it will help you to improve the circulation. Okay. So next technique is percussion. So we are seeing the third technique. Okay, there is percussion. See, this techniques I will teach you tomorrow on a pillow. Okay, I will on my video, and I will be teaching you on the pillow, so that you can practice all the techniques on a pillow. Then later on you can do it on your partner. Is that clear? So tomorrow, like, we will have a practical session. I will teach you how to do it on a pillow. Then we can start practicing on other. Okay. So next technique is called as percussion. So percussion means it is again a Latin word. Percussion means to hit. Okay, so this is the hardest technique of the massage. So percussion means to hit the body. So it is like a you have to hit the body in a rhythmic manner. So when you are hitting the body in a very rhythmic manner, this will help you to induce certain effects. Okay, so this percussion, that means to hit. So hitting the body with the proper stimulating strokes, or with a rhythmic stroke, you have to keep hitting the person's body. Okay, and this percussions can be of four types. One is called as beating. Beating is not like you are slapping any slapping. Okay, so beating is a very heaviest and deepest form. Heaviest means it is giving like a blow. Okay, it is the heaviest and the deepest form. So how you do is you keep the wrist in a very relaxed manner. Okay, so make a fist, or make a fist very loosely and do a continuous beating. Okay, so this rebounding activity is called as beating. Next is hacking. So hacking means striking the body part with one hand using the ulnar side of three fingers. Okay, so using the ulnar side of little finger, ring finger, and the middle finger. So using the ulnar side of the finger, you will be striking the body parts. So here it is not like in the beating, you will be having wrist flexion and extension. Okay, here in hacking, you will be doing ulnar and radial deviation. Okay, so in beating, you will be doing flexion and extension of wrist. In hacking, you will be doing ulnar deviation and radial deviation. Okay, ulnar and radial deviation you will do. So um, this is your hacking. Okay, so using your ulnar side of little finger, ring finger and the middle finger, you will be striking the body part in such a way that you are doing ulnar and radial deviation. Okay, so this is called as hacking. Next is tapping. So tapping is the lightest form and more superficial. Okay, very lightest form. So using your fingertips, you have to just tap. Using your fingertips, you have to just tap. So you do a flexion and extension of your fingers in such a way that you will be using the fingertips. Okay, so if you see here, this is your hacking. Okay, so this is your hacking. Then next sub classification of percussion is cupping. So cupping is you make a cup like shape. So you make your hand like a cup like shape and do a continuous flexion and extension of wrist. So this is called as cupping. So this cupping is especially done to clear your respiratory problem. So if you have secretion and if you have a lot of mucus secretion in the lungs, then you can do this cupping, and this cupping will help you to reduce the mucus plug. Okay, so it is nothing but you make a cup like structure of your hand and do it continuous flexion and extension. Okay, so we have four types of percussion. One is beating, hacking, tapping and cupping. Okay, so this is hacking, this is cupping. Okay. So next technique is called as petrissage, or it is also called as kneading. Okay, so it is called as petrissage or it is also called as kneading. So here petrissage means, again it is a French term. So petrissage means to rub or to rub forcefully. Okay, to rub forcefully or to knead. I hope you know, like you will be kneading the batter for making chapati or parota and any other thing. You will be kneading the batter, right? So that is called as petrissage. So kneading means to rub forcefully. Okay, so that is called as petrissage. So here what you do is you lift, squeeze and press the tissue. Okay, so lift, squeeze and press the tissue. Lift, squeeze and press the tissue. So that is your petrissage. So this will help you to break the adhesion. So maybe a skin adhesion, maybe a muscle adhesion, maybe a superficial fascia and the deep fascia has some adhesion, anything. So you can just lift the skin, you can squeeze and press down. So this will help you to break the adhesion form that is formed. Okay, next is picking up. So picking up is, in this petrissage you have again four technique. One is picking up, next is compression, then circular kneading, ringing, skin rolling. So we have five techniques in this petrissage. Okay, so petrissage is divided into five sub classification. First is picking up. So picking up is picking the tissue, squeezing and leaving it down. So picking the tissue, squeezing in a circular form and leaving it down. So this is called as picking up. Okay, then next is compression. So compression is nothing but giving a pressure with your hand. That is giving a pressure with your hand with in a cup-like structure. So that is called as compression. Okay, then next is circular kneading. So circular kneading is nothing but you have to rub the body part in a circular movement using your palm. So using your palm and fingers, you will be rubbing the body part in a circular manner, like how we will be doing normally anybody to encourage them. Okay, so that is your circular kneading. So fourth type is called as bringing up. So bringing up is nothing but you will be holding the tissue with both your hands, then do back and forth technique. Okay, so you will be lifting the tissue with both your hands, then you will be doing back and forth. So this is called as bringing up. Okay. Next is last one is called as skin rolling. So skin rolling is you lift the superficial skin and rub along with the deep one. Okay, lift the superficial skin and rub along with the deep one. So this is called as skin rolling. Can you see? Lift the tissue, then rub along with the deep one. So this is called as skin rolling. So this will help you to break the adhesion that is formed in between the skin. Okay, so this is the adhesion that is like this will help you to break the adhesion that is formed in between both the skin or the muscle or anything. Okay, so these are the 5 types of bed massage. One is to picking up, ringing, compression, circular kneading, and your skin rolling. Is that clear? So this is about the fourth technique. Then fifth one is called as friction. So this is nothing but like this. So you will be applying using your fingertips, like using your thumb, you will be applying a pressure and you will be rub the tissue. Okay, so with your fingers or your thumb, you have to apply the pressure and you have to give the rub. Okay, that is called as friction. So here it is normally done to break the adhesion in the joint structure. Whenever the person has problem in the joint structure, so you can use this and break the adhesion in the joint structure. This will help you to increase the range of motion. This will help you to align the collagen tissue within the tissue, and this will help you to align the improve the range of motion. Okay, so that is your friction. So normally this friction is given by fingers or a hand. This friction is given in a circular manner or it is also given in a transverse manner. Circular manner means like you will be doing it in a circular form. Okay, so that is your circular manner. And like transverses, you have to do it parallel to the fibers. Okay, so just parallel to the fibers, you have to do a parallel movement. So that is your transverse one. Circular is round one and transverse is parallel one. Okay, so this friction will help you to break the adhesion inside the joint, break the adhesion in the tendon or any scar tissue or any other adhesion. You can break it and you will be able to improve the range of motion. Is that clear?
Yes,
So
miss.
whenever the person is having inflammation in the early stage of inflammation, you should not give this friction because that will disrupt the healing process. So you have to give friction only at the later stage. So only when you are able to align the scar tissue, you need to do. Okay, so this will help you to reduce the scar tissue formation and this will help you to totally avoid the scar tissue formation. Is that clear? So if the body part you are using is a larger part, then you can use the elbow, you can use your larger muscle. You can use the elbow and you can use the elbow on a larger muscle because that will help you to give the pressure. Okay, that will help you to give good pressure and break the adhesion. Okay, then place the muscle in a relaxed position when you are giving this friction, then apply pressure to reach deeper into the tissue. Okay, so you need to apply deep pressure, then only you can break the adhesion and you can improve the range of motion. So the last one is called as vibration. So the vibration, or it is also called as shaky movement. So here the vibration means it is a continuous trembling or a shaky movement. Okay, then shaking is repeated movement over a soft tissue in a front and back manner. Okay, so vibration is continuously you can give like a trembling manner. Shaking is you have to hold the body tissue and move back and forth. So that is called as shaking. So vibration is divided into two. One is vibration, another one is shaking. So vibration is trembling movement. Shaking is repeated back and forth movement. Okay, so this will help you to give relaxation to that particular tissue. So again, vibration can be given using a equipment or using a hand. Okay, so vibration can be given using a equipment or using a hand. So this kind of equipments are there where you will be keeping it and it will be giving you the vibration movement. So these are the techniques of massage. I think we will stop here. Okay, so these are the 6 types of technique. Tomorrow we will see practically all the 6 classification. Then we will go into the other part. Okay, and I just want to ask, can we have the class tomorrow morning, 8 o'clock?
Yes, Miss.
Can have
Yes.
ready. Okay, so I will edit the same invitation. You will be able to join that. So first we will see practically all the 6 classification. Then we will see the technique. Is that clear? See how to do in other technique wise. Is that clear? So I will stop here because I have exam duty at 1 o'clock. Thank you.
Thank you, Miss.
Thank you, Miss.